Thank you so much. As mentioned, it really is a pleasure to be here today and to have the opportunity to share with such esteemed colleagues. I really enjoyed everybody's presentations, just covering all the ground from different aspects from DNA, epigenetics, and nutrition. I have been teaching Qigong and been a student of traditional Chinese medicine for a long time, since for almost 20 something years. And my specialty is truly fitness movement and using the principles of five elements theory along with the foundation of Chinese medicine and into the application of Qigong. So over the course of the years of teaching, we've seen a lot of students come, and we're talking in Qigong, not the Qi emission side. In this case, I'm going to talk about Qigong movements themselves. And many people come to Qigong because they already have a diagnosis of some sort. They are working through a medical condition. They're hoping to change something internally about themselves that can be measured through allopathic medicine. So in working with this demographic or folks, trying to help them find solutions, of course, there are many ways to restore homeostasis and restore balance in the body. Nutrition, traditional medication, herbal medicine, meditation has been discussed in so many different ways, right? But the premise that I'm going to discuss with you today is that for healing to occur, the actual environment needs to support the prescription. So not only does the Qigong have to be appropriate for the condition that the person is presenting, but the entire constitutional environment should be considered for the Qigong prescription or the Qigong practice to be effective and sustainable over time. And this is not new to anybody here. We all subscribe to the same theory. Our body needs to be in the right environment to support healing. So what happens when students or practitioners, they come and they have a diagnosis of a condition? In at least here in the United States where I live, and I realize we're speaking to a global audience. Here in the United States, there's the medical system focuses primarily on a diagnosis and a prescription or an intervention to treat the particular diagnosis. Well, the caveat of that, or the pitfall, is that a patient may come or a client may come really wanting to have change and wanting to make a difference in their life, but due to some of the limitations of the system and how we go about treating folks today, there's an incomplete perspective on the path to wellness. So a person may come, they see a doctor, they get a diagnosis, the blood work's been drawn, etc. And then there's a prescription and maybe a cursory, because of the limitations, guidance that says, you need to get your health back in order, maybe work out some more, eat better foods and so on. But it falls off at that point. And this is where the work of a specialist or folks like ourselves can come in and really provide a big difference for them, is to help create the environment that is conducive to healing. When we treat the person constitutionally as a holistic human being, where every system in the body is as important as every other system in the body, then we go from a perspective of managing a disease where we're hyper-focused on a particular system and only looking at that particular system into a concept of reclaiming health and wellness. There are several things that happen when we move from managing a disease into reclaiming health and wellness. One of them, of course, intuitive in this, is the idea of hope. Hey, there is a possibility of either getting this under control or perhaps even having this become just a part of history. In other words, I've resolved the condition and it's no longer part of my life. And then there is a idea that we can become more interactive rather than passive with the diagnosis that's been given. When we're just managing, we receive the diagnosis passively. We're taking medication. The body is something that's being acted upon. and we don't really understand how this how we can take this condition into the context of our entire life and make it something that we actually work with and try to resolve. When we start to reclaim our health and wellness, then we start to ask questions. What can I do? How can I participate? What can I shift? What can I do differently that's going to impact the result, perhaps in tandem with medication and with intervention at the same time, but I'm going to work more holistically into the entire constitutional environment which I'm treating my disease with. For some of you, this is just repetition, but traditional Chinese medicine works on the three treasures, which are Jing, Qi, and Shen. And Qigong and Tai Chi do the same thing. And our body is moving at the same time that our breath is working. And our mind is being applied towards a specific outcome or a pattern of movement or a visualization. And this triple focus allows for a very impactful exercise that has the possibility of treating not just a single area of the body, but impacting every single part of the body. And as mentioned before, of course, it's really great for older generation, people who are recovering from surgery, who need rehabilitative exercise, because it's tailorable and you can adapt it to your particular current physical level. However, as I mentioned, over time, I did discover that there's a plateau. So what happens is that people come in, let's just take hypothetically high blood pressure, hypertension. Somebody comes to Qigong with hypertension, and within the first several weeks, they may see really great results because they've started something that is holistic. It works all three parts of the body. But what happens over time is that it plateaus, and now we're not getting the same. We're not getting the same effect as in the beginning. And my observation was that what we're missing is the application of physical fitness to the Qigong. So if we already have a constitutionally deficient individual practicing Qigong and Tai Chi, we're going to receive modest gain, but over time, the gains are going to taper and we won't have as much. So what happens if we add physical fitness to it? Well, I just will quickly go over what the benefits of Qigong and Tai Chi. Of course, we know that it, as I mentioned, it works through all of the different systems. You get nervous system, cardiovascular, you get musculoskeletal balance, it works the brain, it works everything. So I'm not going to read all of these. We all know what they are, and they're very powerful when they work together. And the research backs it, which is the great thing. We know that there's tons of research by credible institutions that have funded the research in Qigong and Tai Chi. The benefits are lengthy. In fact, at the end of this presentation, there's a long list of references that one can go to look at that more deeply. But as I mentioned, the missing piece was resistance training. Because of the gentle motion of Tai Chi and Qigong, we're not putting a lot of emphasis on resistance training into the muscle, except maybe for the legs if we're able to do big stances in Tai Chi and Qigong. But the arms really don't get a lot of workout. However, what is the impact of not addressing muscle if Tai Chi and or Qigong is the primary form of exercise that a person is following for in their path of rehabilitation and restoring their health? Well, muscle is, by volume and by mass, the largest conglomeration of tissue in the body. So that's significant. It is also the main source of our storage of protein that is essential for all of the metabolic functions and the repairing and restoring functions of the body. More muscle, more lean muscle, builds insulin sensitivity and helps with glucose management. It can be a great way to manage diabetes. So the point here is that we need to have more muscle mass, build more lean muscle in the body, for the source of the primary source of metabolic function in the body happens in the muscle. So if we're considering a demographic of people who are, let's just say 40 years and older, already sarcopenia is occurring and muscle mass is decreasing, exacerbating or amplifying the possibility of secondary diseases to occur because the metabolic function in the storehouse of these proteins is now becoming smaller and smaller. Muscle fuels the immune system. It's the main producer of glutamine, the fuel that immune cells work with. Skeletal muscle stores 80% of the body's glutamine, and it's concentrated 30 times higher than in blood. Skeletal muscle also releases myokines, which are anti-inflammatory signals. So this is the precursor to having a strong immune system. It has been studied, there are some sources listed here, but muscle loss can be tied directly to a weakened immune system. So if we have a patient coming with a diagnosis and they're trying to get better, obviously the immune system needs to be supported and reinforced, and we can do that with external methods and complementary medicine methods, but we can also focus on looking at what the quality of the muscle is and potentially in adding strength training or resistance training to a routine to enhance the immune system. The relationship between muscle mass and lean muscle mass and quantity is directly linked with the risk of mortality. And we know that there are studies that show that any type of resistance training can lower the risk of all types of mortality by about 15%. The peak benefit of that is about 60 minutes a week of strength training. Now that can be body weight or it can be external weight. In the methods that I'm describing, I'm focusing primarily on body weight. So that could be, as this woman is showing here, it can be a modified plank, it can be push-ups, it can be sit-ups, it can be yoga, it can be anything that puts resistance training onto the muscles of the body. And if you add that to any type of aerobic activity, then it will actually amplify the benefits of both. So now we have strength training and movement training, Qigong, Tai Chi, independently, of course, they provide benefits, but the overlap of practicing both of them together is exponential. We get more durable strength, we enhance the quality of muscle, we get an integrated flow, deep vital resilience, so we're working on a metabolic level, so now we have enhanced metabolic activity. We have sustained autonomy because our systems are now working holistically together with each other. And we have, of course, the magic integration of the three treasures of body, breath, and mind. In the system that I'm working with, I work primarily with the 5-element theory from traditional Chinese medicine. And in this case, we're looking at enhancing Jing, which some folks here on today have talked about replenishing Jing through foods and through herbs and how important it is. And in this case, I'm talking about restoring Jing through enhancing structural foundation. So paying attention to our actual muscles, overlaying that with the 5-element theory to begin to understand which areas of the body need to be addressed first. And then, of course, with the body, breath, and mind integration to provide the most enhanced and complex comprehensive healing. In the structural foundation, level 1, or layer 1, I should say, your conditioned tissues communicate more efficiently. We know that muscle mass that has less fat interspersed within the muscle tissue will communicate through the fascia and the connective network more efficiently. And that is just from the perspective of physiological science, but we also know that if we overlay that same concept into qi and fluids, then the fascia is able to communicate the electrical impulses easier as well as Dr. Rabinath talked about the DNA and the light. Well, if the less fat allows these transmissions to occur more efficiently as well. So just basically repeating that resilient fascia and sinew channels carry movement and signal, and without structural readiness, subtle practices stay on the surface, so we're allowed to go deeper. By using 5-element theory as a clinical map, what we get to do is understand the patterns and how they evolve and how they're representing through the different organs in the body. 5-element theory is quite complex. It's beyond the scope of this conversation, but what it does do is provide an excellent roadmap to understand patterns and what meridians and or organ systems relationships might be affected at the moment, and understand which exercises might be most appropriate to help this person come back to harmony. The last layer is, of course, the body, breath, mind integration, where we are working simultaneous with movement, breath, and mind, applying all 3 layers towards a common goal, where the nervous system is the bridge, and the goal is coherence, not necessarily relaxation. So viewing this as a method to exercise the complexity of the human system, the human condition, all layers at the same time, provides extra benefit beyond just working any one of these layers independently. At the end of a practice of a determined time, then what one could expect to have is an increased feeling of autonomy and no longer a feeling of dependency on somebody else or something external from me to provide the balance that we're looking for. Instead, what patients and clients discover is a framework that gives deeper body literacy. They understand how relationships of the different systems come together, the impact of maintaining homeostasis in each of the systems, or optimal performance of these systems together as they support each other. As I mentioned, a reduced reliance on passive interventions or things that are external to oneself. And of course, people report all kinds of benefits. They report feeling in control of their life again, in control of their health. They have restored agency. They feel coherence. Things are feeling better again. The mind and body are connected. And they have a better enhanced understanding of, again, the nutrition and their body. Putting it all into practice is, I would say it's fun. It's something that I enjoy doing. Working with the 5 elements is exciting. It gives a lot of detail, a lot of possibilities of what we could do here and what we could do there. But as a practitioner, if one was prescribing this, then what it does, it provides the opportunity for highly tailored and individual programs that address the particular needs of the person based on all of the factors that they present at that particular time. So patients learn to self-regulate and self-prescribe. That's the end of my actual presentation. I just want to say how exciting it is that we are sharing all of this information on restoring health and bringing all of these practices in together. I think this is just one method of doing that. And I appreciate the opportunity to speak with colleagues today. My name again is Christina Barea, and I am here for any questions that you might have.